Hello everyone and welcome to our channel. As we begin today's journey, we take a deep dive into the impact of nutrition on arthritis symptoms. Arthritis, a disease characterized by joint pain and inflammation, can seriously affect the quality of life. Thus, understanding how certain foods worsen these symptoms becomes paramount to effectively managing the condition. In this review, we take a close look at 5 specific foods that are known to aggravate arthritis symptoms. Unraveling the complex relationship between nutrition and joint health aims to shed light on the mechanisms that influence pain and inflammation. But fear not, our journey does not end there. In addition to identifying the culprits, we also start looking for solutions. By exploring dietary changes and possible alternatives, we strive to provide you with the information and tools you need to navigate the complex stages of arthritis treatment. So join us as we embark on this educational journey to discover the truth about arthritis triggering foods and pave the way for better joint health and general well-being. Let's embark on this journey with curiosity, knowledge, and a quest for better health. Arthritis, characterized by joint swelling, pain, stiffness, and decreased mobility, comes in many forms, but the most common are arthritis and rheumatoid arthritis. Osteoarthritis, often the result of aging or injury, occurs when the cartilage that cushions the ends of bones wears down, causing the bones to rub together, resulting in pain and stiffness. Rheumatoid arthritis is an autoimmune disease in which the immune system mistakenly attacks the joint tissues, causing inflammation and pain. It can also affect other body organs. Other types include psoriatic arthritis, which is common in people with psoriasis, and gout, which is caused by high levels of uric acid that form sharp crystals in joints, often in the big toe. Fibromyalgia, although not arthritis, includes similar conditions, widespread symptoms of muscle pain and fatigue, and can sometimes be confused with arthritis. What all these conditions have in common is inflammation, which is the body's response to injury or illness. In arthritis, this inflammation is the main cause of joint pain and swelling. Now let's start with the first food that can make arthritis symptoms worse, and then look at the root cause of arthritis. Red and processed meat. Number 5. Red and processed meat. Let's start with the 5th biggest offender on the list. Red and processed meat. You've probably heard time and time again about the pitfalls of regular meat consumption, and unfortunately, its effects on arthritis is no different. When we talk about red and processed meats, we're referring to meats like beef, pork, sausage, hot dogs, and bacon. What makes these meats problematic for arthritis is their high concentration of advanced glycation end products, often abbreviated to AGEs. These compounds are known to drive inflammation in the body. Inflammation plays a critical role in arthritis and is often the trigger behind common symptoms such as pain, swelling, and stiffness. When inflammation levels rise, these symptoms often worsen, making managing arthritis more challenging. In addition to AGEs, red and processed meats are also rich in saturated fats, which some research suggests could further increase inflammation. This double whammy of AGEs and saturated fats makes these meats a particularly troublesome food group for those with arthritis. The link between red meat consumption and arthritis risk was highlighted in a study published in the American Journal of Clinical Nutrition. The study found that women who regularly ate red meat had a higher risk of developing rheumatoid arthritis, a type of inflammatory arthritis. So while the occasional indulgence might not harm, it's advisable to limit the intake of these meats where possible to manage arthritis effectively. Alcohol. Number 4 on our list is alcohol. We all know that moderate drinking can be part of a healthy lifestyle, but it's important to be aware of your alcohol consumption when dealing with arthritis. The main reason for this is alcohol's ability to trigger inflammation in the body. Excessive alcohol consumption can increase inflammation, which worsens arthritis symptoms. This can mean increased pain, swelling, and joint stiffness, making daily activities more difficult and reducing overall quality of life. But the effects of alcohol on arthritis are not just limited to inflammation. Alcohol can interact with arthritis medications in potentially harmful ways. Some of these interactions can make medications less effective, which means your symptoms are harder to control. In other cases, mixing alcohol with certain medications can cause dangerous side effects, such as liver damage or an increased risk of bleeding. A study published in the journal Rheumatology showed a strong link between heavy alcohol consumption and the risk of developing arthritis, specifically identifying an increased risk of certain types of arthritis, such as rheumatoid arthritis and gout, among alcohol drinkers. Given these potential risks, it's important to discuss your alcohol consumption with your doctor, especially if you're taking arthritis medications. They can offer personalized advice on safe intake levels to ensure your arthritis is treated in the most effective way. And remember, when in doubt, it's always a good idea to choose a non-alcoholic drink. The most important thing is to find the products that work best for you and your body. Dairy products. The third culprit on our list is dairy products. Now, this may come as a surprise to some, as dairy products are often praised for being high in calcium and promoting bone health. However, in some people with arthritis, dairy products can make symptoms worse. The problem with dairy is the type of protein it contains. For some people, this protein can trigger an inflammatory response in the body. As we mentioned before, inflammation plays an important role in arthritis and can make symptoms like pain, swelling, and stiffness more pronounced. In people with milk sensitivities, the inflammation caused by this protein can cause a significant increase in arthritis symptoms. A study published in the Nutrition Journal supports this. A study found that people with osteoarthritis who removed milk from their diet had a significant improvement in arthritis symptoms. Of course, the role of dairy in arthritis is not unique, and not everyone with arthritis needs to avoid dairy. However, if you've noticed a connection between your dairy intake and your arthritis symptoms, it's worth trying a dairy-free diet to see if your symptoms improve. Refined sugars. We're ready now. The second biggest food culprit for arthritis. Refined sugars. These sugars are found in many foods, including cookies, cakes, candies, and many processed foods. The problem with refined sugars is their ability to trigger the release of inflammatory messengers, cytokines, in the body. When these cytokines are released, they can cause inflammation throughout the body, which in turn can worsen arthritis symptoms. Not only can refined sugars worsen existing arthritis symptoms, but they can also increase the risk of developing certain types of arthritis. A study published in the Journal of Nutrition found that a diet high in refined sugars and other carbohydrates significantly increases women's risk of rheumatoid arthritis. The reality is that reducing refined sugars can be difficult, especially when you consider that they are so prevalent in our food supply. But by making small changes, such as replacing a sugary dessert with fruit or choosing water instead of a sugary drink, you can begin to reduce your refined sugar intake and possibly see an improvement in your arthritis symptoms. High in salt and preservatives can exacerbate this chronic inflammation, worsen arthritis symptoms, and potentially cause new joint damage over time. Reducing your intake of foods high in salt and preservatives can be difficult, especially given their prevalence in today's diet. However, making conscious choices to choose fresh, whole foods over processed foods can greatly improve your overall health and well-being, including managing your arthritis symptoms. Choose home-cooked meals that contain fresh ingredients. Egg, fruits, vegetables, lean proteins, and whole grains can help minimize exposure to salt and preservatives. In addition, carefully reading food labels and choosing products with less sodium and fewer additives can help maintain a balanced diet. Adding herbs and spices to flavor foods instead of salt can add flavor without negative effects. Effect on health. Experimenting with different cooking techniques, such as grilling, roasting, or steaming, can also enhance the natural flavor of foods without salt or preservatives. Additionally, excess sodium can be removed by staying hydrated throughout the day by drinking plenty of water of your body, reducing the risk of inflammation and supporting overall joint health. In addition, Regular exercise tailored to your abilities and preferences can strengthen the muscles surrounding your joints, improve their stability, and reduce pain and stiffness. By considering your diet and lifestyle, you can take proactive steps to manage your joints, arthritis symptoms, and promote long-term joint health. Although it may take some adjustment and persistence, the benefits of reducing your salt and preservative intake far outweigh the relief of arthritis discomfort, contributing to a healthier and more vibrant life. Remember that small changes can have big results, so start implementing these strategies today for a brighter tomorrow that won't cause you unnecessary pain and discomfort.